There are a lot of things keeping us awake at night these days. Top of the list, the health of our loved ones. Tonight, I am sitting down with a man who refuses to be silenced. Now, listen, this man has walked through fire, personally, politically, professionally. I am talking about Robert F. Kennedy Jr., Secretary of Health and Human Services. Now, you're saying clearly there is a powerful genetic predisposition. You're wanting to know what the interaction is between the genetic predisposition and environmental toxins or behavioral interactions. You're wanting to know what the interaction is between all of the factors. Let it be 90, 10, 95, 5, whatever. You want to know what the interaction is.
Well, whatever's causing the epidemic is not genetic. As I said, you know, people who smoke cigarettes, 1 out of every 4 to 5 died of lung cancer or got lung cancer. That means there was four of those 5 who didn't, so they were okay. So you'd say, is it genes that is causing the epidemic of lung cancer? No, it's not. It's an environmental exposure, and that environmental exposure disproportionately impacts people with different genetic makeups. And we know a lot about the genes among autism kids. We know about some of the genetic differences, that there tends to be less glutathione production. There tends to be higher testosterone. There tends to be less of a capacity to excrete metals, and many of them, in one case 100%, in one study 100% of the kids had mitochondrial disorders. Mm-hmm. And that indicates that the cause could be an accumulation of materials in our environment that are affecting mitochondrial function, and that the kids who already are in the race with low mitochondrial function, metabolic dysfunction, are the ones who get hurt. And so we need to look at all of those things, and then we need to do specific looks at the different environmental exposures, and those could be foods, they could be electromagnetic radiation. We know, I mean, a couple of things we know is that we know that it's a toxin that became widespread around 1989, because Congress asked EPA, what year did the autism epidemic begin? And the EPA scientists came back and said it's a red line, 1989.